Dr. Gabriela Andujar-Vasquez, an infectious disease specialist and the associate hospital epidemiologist at Tufts Medical Center. Good to see you.
Good to see you too, Emily.
So we take a little deeper dive into this number. Are the people who are most at risk from the disease now protected?
So not quite yet. I think that this is an important milestone for the Massachusetts residents. I think that we have to feel proud and celebrate about this milestone. We do have a good proportion of our population fully vaccinated, and that in addition to the proportion of people that have had, unfortunately, COVID-19 throughout the past year, we have a good percentage of residents in Massachusetts that are vaccinated or protected by natural immunity against the virus. But we still have a lot of work to do in order to protect those that are most vulnerable.
When we talk about that, you know there's no vaccine authorized yet for children under 12. Other than these little kids, which groups are left to vaccinate?
I think that we still have a lot of work to do across different age populations. You know, it's different in Massachusetts when compared to the nation. Around young adults actually here are getting vaccinated more so than in across the U.S. and other states. But I also think that we have to think about the people that are vulnerable because even though they're fully vaccinated, they still are, because of their weak immune system, they still can be vulnerable to getting COVID-19. So if every one adult gets vaccinated right now, we will be able to protect those that are still more vulnerable. So we need to keep the trend going.
That trend, the number of new cases really down dramatically. Have you noticed this change at Tufts? Are you seeing fewer patients with COVID?
Yeah, sorry, absolutely. We have seen a complete decrease in the number of COVID-19 infections. In fact, we only have 6 patients right now admitted in the medical center. But I would say that the people that are getting admitted are people that are not vaccinated. So this is really a vaccine preventable disease now. So we don't want to see people admitted with this devastating disease and not being vaccinated.
A vaccine preventable disease. All right, Dr. Andujar-Vasquez, thank you so much for your time. We really appreciate it.
Thank you.